Well, let's launch straight into our press preview now with Kate Williams and Mary McLeod with us this evening. Let's start with the Sunday Express, and this is a story that's been around throughout the week, the one of Southern Cross. A bit more detail about the abuse, shame, past of the crisis hit Southern Cross. That's the headline there in the newspaper.
Yes, absolutely. This is on page 2 of the Express, is their own investigation to Southern Cross, saying not only have we got the chaos that's going on, the financial chaos, the notion that they're going to pull the plug at the end of the month, but also there's been abuse. It says 16 of its homes, they're saying there's been abuse here, locked up, malnourished, not bathed for a year, fleeced of savings. So 3 people hadn't had a bath for a year, a series of people found dead with, bed sores, mentally ill people locked up. Someone broke their leg and there was no notice of this. So what it's really saying here is there's been even though there are 750 homes and this is only 16, there's been a series of abuse. And as they're quoting here from the founder of the Compassion and Care charity, Eileen Chubb, she's saying, the system is failing the vulnerable. Serious questions should be asked about the privatisation of care.
And Mary, this is the biggest elderly care provider in Britain.
Yeah, I mean, I think it's really important that we actually, whenever we find out that there's the possibility of abuse or neglect, that we have to deal with it immediately, because these are some of our most vulnerable elderly people who are potentially being subjected to this abuse and neglect, and we need to get it stopped. So it's absolutely right that there should be an immediate investigation into it and to find out just what the real issues are.
I mean, it seems like something from the kind of 18th century that's like the workhouse. They're just being left to die with their bed sores. It's just terrible in the modern age.
But do you think the government should be slightly embarrassed that the fact that this came to light through a television programme, really?
Well, I think you have to look. I mean, any way it comes across, whether it's individuals, families saying that there's a problem, we have to look at it. And it's and thankfully in this case, the television programme identified this, and therefore, we've absolutely then got on top of it and tried to find out what the real issues are. But it's so important in terms of how we care for our elderly, and the importance. I mean, some of the issues that are mentioned here are just absolutely scandalous if they're true.
But in your view, were the government checks in place sufficient?
I don't know, to be honest, on this in this particular case, but it does make us then look again to see whether we have the appropriate checks, whether we are reviewing these homes in the right way and often enough, so that we're making sure that our elderly get the best care possible.
And are there enough checks? I mean, are there enough people there to look at what's going on here? I mean, 3 people not having a bath for a year. It's unbelievable, really.
Absolutely. We're staying with health, not just of the elderly, but for all of us. We're hearing now that the Health Secretary, this is in The Independent, is saying that the NHS must work smarter.
Yes, and this all comes from the NHS and the health reform bill that's been going through Parliament, and then of course we've had a point where we're listening more to the feedback that's going on across Parliament with clinicians, with other people involved in the NHS, and getting feedback on that bill. The listening exercise is now over, and Andrew Lansley, the Health Secretary, takes it back to the Commons. But this article is interesting because it's highlighting the need that we absolutely need to get more efficient in the NHS. We do need to reform the NHS. And it's all about making sure that the health service the patient is at the centre of the NHS. And if we keep that as a focus, that is about patient outcomes, then we will improve the NHS in the right way. But it's all about the reform to improve it so that patients get better care.
But these key words here, the buzzwords of working smarter, is that just a cover for plain old simple cuts?
Well, it seems as if it might be cuts, and one of his big principles here is the idea that there should be more care of patients in their homes, which is going to be quite a complicated issue when you think of the increasing problems of our in the NHS was how we're seeing health in the future, more obesity, increasing amounts of cancer. How can we care for people in their homes when these are the kind of diseases? In the old days, it was more heart disease, people dying of old age, and increasingly, I think, so many of the diseases we're suffering from in the modern world, cancer, obesity, are the things that need to be dealt with in the hospital, and I think
But more
I
and
don't
more
know how we
money,
can
more and more
cut.
money is going into the NHS because people are living longer, and we're discovering more in terms of medical science, and we put more money into cancer drugs. So there's a lot of money going in. But if you ask anyone in the NHS, they will say yes, absolutely. We can become more efficient and better at what we do. So we do need to make sure there's investment in healthcare and linked to social care, because that's where you actually look at how you make sure people get the care they need, not just in hospitals but also out in the community.
Well, when you think that the majority of people use the NHS in their final years of their lives, and this is when they're the most vulnerable. We've seen with Southern Cross, it's disaster. We can't have that. We can't have people being hired at cut price. I mean, the suggestion is in the Express that it's kind of cut price staff who can be so cruel and so neglectful. I mean, absolutely, we need to make sure that the NHS can't make these cuts on staff. Where they're going to make the cuts is the complicated point, not drugs, not staff. That's the
But
hard thing.
cuts and efficiency aren't the same thing. So you can be more efficient. So we're putting the investment into healthcare, but you can get better and improve the way you work with better practices and doing things in a better way. And that's what we're
Rather
trying
than
to
reducing staff.
Yes, and then it's about reform of the NHS. It's such a sensitive issue, reform of the NHS, and it takes someone with real courage to do it. And that's what Andrew Lansley is trying to do. Is say we need to look at healthcare in a different way. And the important bit is keep the vision in mind for the NHS, which is about making sure we're improving patient outcomes.
Well, one of the improvements suggested by the Health Secretary, an example is he's highlighting a scheme of providing kidney dialysis at home. Is that something that you would actually support?
Well, I'd probably ask the patient and see what they prefer. Most of my constituents who come to me with issues about healthcare in the NHS, it's about they would much rather be doing things at home or closer to home rather than having to go into hospital. And especially with dialysis, which is something that many people have to do for a prolonged period of time. So, I mean, I'm open to any suggestion for how we can make things better, but we need to involve the patients in it, in understanding what they think is the most effective way of doing it for them.
Let's move on to something completely different, or maybe not. It's a sort of health issue, isn't it? Your hairline, or how much hair you have on your head.
Trivial.
We're talking, of course, about Wayne Rooney. This is in the Independent. He's had treatment to cure his a different kind of hairline fracture. That's their headline there.
Yes, poor old Wayne. Page 5 of The Independent, we've got, at the age of 25, he said, "I am going bald." And he revealed the news, like everyone's revealing all pieces of news at the moment, on Twitter. He said, I've had my hair transplant, and why not? I'm delighted with the result. And it seems as if, he's had quite a few rude comments. Michael Owen says, your face looks like a 12-year-old, but your hair looks like a 60-year-old. So poor Wayne was driven to pay a fortune for a hair transplant. And we've got a whole list of famous men here who have their hair transplanted in private clinics. It's obviously not something that's available on the NHS. And we don't have yet a picture of, what exactly this bruising that Wayne's saying he suffered in the quest of beauty. But, who knows where cosmetic surgery for footballers could end.
I'm sure a lot of Man U supporters are worried that he might not be able to head the ball when required if he's got a bruised barnet.
He's got a scar. We don't, this Samson and Delight will keep his hair, so, keep him strong.
But quite surprising, though, do you think, that he's actually been quite open about it? Because previously it was something that men might want to hide.
Well, I think some of these men have been hiding it. The suggestion they didn't have hair transplants and it just grew. But, Wayne seems to be very honest about it. Onto Twitter he goes, exposing all the news. Well, I guess with all the other news about footballers we've vaguely had, a hair transplant doesn't seem quite as exciting as some of the other stories we've had recently.
Mary, what's your take on this story? Newsworthy?
Well, there are probably many men out there who are interested to read it and see what Rooney's doing. But it's, and I think it's good he's been transparent about it. I think the more that people talk about the issues, the personal issues they have, whether it's illness they're going through or even something like this, I think it's probably a good thing because many people probably can relate to it.
So do you think quite a few men will take it seriously and think if Wayne Rooney can be open about this, and they probably will up to find out the name of his doctor, really, if it's worked for him, it might give a lot of men hope.
It might do.
It's very expensive, though. It's incredibly expensive treatment.
This is the thing,
you
have to have the bucks.
You have to be rich. You have to be, and increasingly plastic surgery is becoming a kind of status symbol. And I have the money to spend on my hair. It's a lot of money. Although I guess he doesn't have to have much on haircuts or colouring. He saves some money that way.
We shall see. The Mail on Sunday now. Mary, you wanted to take us into this story. Can we get it up on the plasma there? Oh, Saint Bono facing huge Glastonbury protest for avoiding tax. We thought Bono could do no wrong.
Well, yes, you know, this was obviously, this is a big story in the Mail on page 13 that Bono, you know, our saint, is facing a huge Glastonbury process when U2 appear in Glastonbury pretty soon now because of the fact that they live in Ireland and so therefore avoids tax because he's classed as an artist. And a spokesman for Art Uncut, an offshoot of controversial group UK Uncut, said the protest would not be violent or disrupt U2's set, but would be highly visible. And apparently it says, you know, the Mail is investigating, saying U2 and Bono have been very reluctant to explain their strategy, but The Edge said, of course, we want to be tax efficient, who wouldn't? So we're losing millions and millions of pounds there, I think, in tax there.
Kate and Mary, thank you very much for the moment. We are going to take a break. Do stay tuned, all coming up very soon.
Look at this.
Welcome back. We're taking a look at tomorrow's newspapers with royal author and historian Kate Williams and Conservative MP for Brentford and Isleworth, Mary McLeod. Let's have a look at, we wanted to look at the story to do with May and Gove, a bit of a row. They're not getting on over certain issues. This is in the Mail on Sunday.
Yes, this is the headline on page 5 that May and Gove at war over crackdown on homegrown terror. And it's really about the Prime Minister is about to publish a strategy to stop British people becoming radicalised into becoming terrorists. And this is really important because it comes on the back of course, the 52 people who were killed in the 7/7 atrocities in London in 2005. And what I think is underneath all of this is looking about how we can strengthen British identity. It's also looking at community cohesion, which I feel even in my constituency, which is this one here, is just so important. And it's making us go back to sort of real British values and say, you know, what is it that we really stand for in Britain? And it's about, you know, freedom and democracy and rule of law and also sort of equality in so many different ways. And therefore, you know, we have to try and look to see how we can prevent future terrorists from being, you know, grown within Britain. Because I think that's quite a, you know, a scandal that we have in potential people who are willing to become terrorists from the UK itself.
We're going to take a quick break from the papers, but it's a story that has been running through all of the tabloids. This is the hiring and firing of Cheryl Cole. And we have breaking news this evening that Cheryl Cole has been rehired by the American X Factor. Joining me on the phone now is Dan Wootton from the News of the World. Dan, what on earth is... we're going to continue with our press preview, but just very quickly, Kate and Mary, is this a story that you think is worthy of newspaper headlines still?
Well, I think it's something that the public are definitely interested in, so I think that's why it still becomes a headline. But who knows what the real thing behind Simon Cowell, his thinking, because, you know, he does tend to know what he's doing. So who knows whether this was something that had been planned from the start or not.
Cynics might say that, but we couldn't possibly comment. Let's speak about E. coli now, an investigation in the Independent on Sunday. Mary, take us into the story.
Yes, the Independent on Sunday, on page 2, E. coli victims. And this is on the back of that 19 people have been killed with this outbreak and 1,700 people infected, mostly around Germany or linked with Germany. But in terms of the source of this, it has so far eluded sort of the health officials in terms of how it has started and where it has come from. They're looking into one restaurant, and of course the restaurant will naturally say that many other people have been to the restaurant and they haven't had any problems at all. But I mean, I do think that maybe this is a bit of a scare story on the news, but it's certainly something that, you know, we want investigated to see what the source of this is. But it's at the moment we have 1,700 infected and 19 killed, so there's still...
All
it's
by
still
a
worth
restaurant called the
investigating.
Potato Cellar, apparently.
Yes,
That's its
yes.
name. So I think we were showing earlier the owner tucking into one of his own ingredients, saying, it's
just
all
to show
fine.
that it's all safe.
It's all fine. But, it's saying here that, these 34 female officials from a German tax trade union seminar, 8 of them became ill from E. coli, and this restaurant does specialise in potato dishes, and obviously now we're looking into all kinds of vegetables, but it looks like it could have begun from the potato. I mean, it seems here that there's really no idea where this really came from. It could have been the farm, it could have been the supplier, it could have been the restaurant. It's so hard to tell.
Still very early stages of investigation. Let's move on to the Sunday Express, and some good news for Kate McCann. The book that she's written has raised £2 million.
Incredible sales from the Finding Madeline book. £2 million, this is what it's raised in just 3 weeks. So 165,000 copies have been sold, and it's been sold all over the world as well. So the 364 pages, so I mean, this is an incredible kind of publishing success. It has been selling across the country, where we cannot forget the Madeline story. We absolutely can't. We would think that there's not really many details we don't know about the story, but we can't forget it.
I'm quite surprised, because a lot of parents that I've spoken to about this book don't want to buy it because they can't really go through the emotional turmoil of reading a story like this, and it is very, very emotional.
It is, and we all know, we saw so much detail about it, exactly what was going on in Portugal, and it's just so painful, I think. But I think we can't give up on the story, we can't give up on the fascination of the story, and I think with the McCanns, we hope that she'll be found. I mean, this is their big aim, that with the book more awareness will come and people will find Madeline. Although I don't know if there's anyone left in Europe who doesn't know every detail about the story.
But it is important to
so
keep
much.
reminding people of it, because there are so many missing children and people that just eventually get forgotten about, apart from their loved ones and family and friends. And I think what Kate McCann's doing is continuing to raise the issue, just because, it's such a tragic story, and something that I think so many people, especially parents, and just empathise completely with the McCanns who went through this in 2007. And it's something that will stay with them for the rest of their lives, and hopefully until, of course, Madeline is found. And that's the whole aim with this, is that if we can find Madeline, then this will absolutely be worthwhile doing.
What did you think about the criticism that British police shouldn't be putting resources into this one case, that there are many other missing children who simply aren't receiving any attention?
Well, there are many cases, and I think the police do look into many of them. And of course, there's many voluntary organisations and charities who help support in this. So it's a partnership and collaboration to try and see what can be done. But as parents, the McCanns, I think, are doing the right thing, and just to keep pushing to try and find their daughter.
And you can't give up hope when you think of
No,
Natasha
absolutely.
Kampusch, and the people are found. I mean, they're found years later, but they still can be found. We don't know where Madeline is.
Just time to fit in our last story, and this is in the Express. Is there too much sex in Britain?
Well, this piece focuses very much on children, really, and it is really important to look at the whole media, the perception the media gives of young people and the over-sexualisation. And certainly, I look at it very much from, I get people talk to me about it from a political perspective and what we can do to support. And it's anything when it's about retailers, or whether it's about looking at videos, and in here they're looking at, for example, videos, whether it's Lady Gaga or Rihanna or whoever it might be, but to say, are they giving the wrong image to young people? And therefore, should we be doing something about them? And there's also things like adverts near schools. And I think it's just important to protect children as much as possible, because what we want to do is make sure that they don't feel that they have that they have to get involved in sort of all the work on sort of sex over as a very young age, and we want to make sure that we support and protect them as much as possible.
In principle, these are quite hardcore ideas. The notion that magazines must all be in paper covers, lads' magazines. But we've just been watching Hugh Hefner saying, "Oh well, it's fine to have the Playboy Club because there's sexualisation across British culture. So have a club full of Playboy bunnies."
And I just
even
feel
he's using it as an excuse.
Yeah, and
But it isn't just down to the images that are out there. Also, there's a lot of parental responsibility. We did have the case not so long ago with parents buying push-up padded bras for 8-year-olds, so it's not just down to the industry.
And little kind of, there have been little pole dancing toys as well sold, you know, for little girls. I mean, all these things
Kate,
have got to be stopped.
Kate and William, we must leave it there. Thank you very much, Kate and Mary, for your views. Thank you. Stay tuned.
You have quite a talented daughter, Mrs. Pierce.